experts suggest the biggest impact of COVID-19 hasn't hit hospitals just yet. But there are already big delays in care because of this crisis, especially for patients who don't even have the virus, such as my next guest. Mary Swark-Hougaard was recently diagnosed with breast cancer. She joins me now from Pickering, Ontario, to tell her the story. So Mary, thanks so much for taking time with us today. We really appreciate it. You have to have your delay in surgery, right?
Yes.
Now, can you tell us a little bit about that?
Yes, I did the regular breast screening program, and they called me that there were abnormalities, so I had to go back a second time and did the ultrasound scan. And then they decided that I needed to do some biopsies, so they went ahead and did those. And then 2 weeks after that, they told me that it's definitely breast cancer and that it's I need to get in on an urgent level and to be ready. And I thought that was okay. When I did get a call from a surgeon, he was able to tell me that their surgeries are closed, and at that point there wasn't a whole lot he could do until he knows what was going to happen. And thank goodness he phoned me a couple of days later and said there's a chance they might get me in at Sunnybrook. But again, I've called and nothing's happening yet. In fear, basically, I started phoning hospitals to find out if their ORs were working or what the scoop was. And there's the odd OR that is open that they are dealing with breast cancer patients. One was in Barrie. I believe Markham Stouffville still were taking patients in, but Ajax, Pickering, any of the hospitals out this end, I don't know of anybody who's accepting cancer patients to do whatever procedures they need, which include for me a lumpectomy to get started.
And when did you think that you were going to get this surgery originally?
I thought it would have been done by now.
Oh.
I thought it was basically they get you in pretty close to immediate. Everything I've read from people, it seems from start to finish is usually a month.
And so far, there's no way you can get into that surgery right now because of what's happening with the pandemic.
With the pandemic. And I'm told, I have some friends that are nurses, various hospitals, and they're saying that they have a lot of empty beds, but they are preparing for COVID-19 patients. So they are not wanting to have anybody up in either their operating rooms or ICUs. And that means the rest of us suffer for it.
I can't. Oh, sorry, go ahead.
I was going to say, your average lumpectomy, they say it only takes about 15 minutes to do. In some cases, they will send you home the same day. I have put online that if I have anybody with a really sharp knife, a bottle of whiskey, and a bullet that I can bite on, knock on my door.
Oh, Mary.
I'm worried sick. I'm worried sick that it's just going to spread and it's going to be too late.
I can't imagine how you're feeling. You got that terrible news, and now you have the terrible news that you can't move forward yet.
Yes, even if we had a definite date, but from what I've understood from some other cancer patients, they're given a new date and then that date cancels. Some people are learning only the night before or the day of.
How are you staying positive and focused through all this? Because it must be so hard for you.
Well, I'm writing a song for Justin Trudeau and COVID-19. I'm doing puzzles. I have basically isolated myself at home with my husband. I'm not leaving the house just in case if any call comes for any surgery anywhere that I'm ready to go. And just trying to keep in touch with friends online and on the telephones. People are my life. I miss people.
Yeah, I hear that from a lot of people. So if you could send a message to other people who are going through what you're going through, what would that be?
Oh, beat the drum. Call your politicians, call the doctors, call anybody who will listen. The one thing I have to say is I've contacted a lady who works in our MPP's office. Her name is Linda Lyon, I believe. And she is making calls and working tirelessly on my behalf. And I'm just praying that it works, because I think we need a little prayer in there somewhere.
We are going to send you a lot of positive wishes, and I'm sure a lot of Canadians are as well, Mary. We're wishing you good luck, and we hope you get in for that surgery soon.
Thank you so much, and God bless.